I am Deanne Roper, assistant professor in practice, and Denise and I are here. And I think if this were a real dating, speed dating thing, we would be overdressed because we have a very beautiful PowerPoint. So I'm going to start, if I can share here my screen and start with our PowerPoint. Here we go. Let's see. Okay. So Denise is our student representative. I'm going to start with a quick overview about the mental health and substance use or substance misuse specialty section. So really, mental health, we kind of have some ideas about it, but I really think that really you get a twofer. You get the best bang for your buck here because you get the mental health specialty, but you also get the substance use disorder specialty, as well as there's also the co-occurring piece that happens with this particular issue. As you know, it doesn't matter whether you specialize in substance use or not, you're always probably going to have an opportunity to work with folks who have been impacted by substance use disorders and or mental health and mental illness. But the NASW describes clinical practice as a primary focus on mental, emotional, behavioral well-being of individuals, couples, families, and groups. And did you know that mental health providers, 60% of them are clinical social workers? When community psychiatry came around the early 1900s, about 1908, I think it was, we were actually working side by side with the psychiatric providers, the psychiatrists in the communities, and that's really when community mental health was born. So you are joining a focus and specialty that has a long history and lots of folks to support you. And then just from a global perspective, I bet a lot of you didn't realize that depression is one of the leading causes of disability around the world. As we know, suicide is an epidemic now. We even have an increase of 13% of mental health issues across the world. So no matter where you go, there's always going to be an opportunity for you to work in the mental health field. And then, of course, in substance use or substance misuse, you might hear it said substance use disorders as well. We know that all of those issues are on the rise with the opioid epidemic, and like our statistic here that says 9 million people in our country, 9 million adults have a co-occurring disorder. That means they have a substance use disorder and a mental health disorder. And causes of death about drug overdose are on the rise, as well as use in veterans. So there's, as you can tell, lots of ways to work with mental health, mental illness, substance use disorders, and really co-occurring as well. So some of the classes you might like, the direct practice of mental health and substance abuse, we use a biopsychosocial risk and resilience perspective where you get to learn how to conceptualize cases. And we also apply a critical lens to the DSM. You learn how to diagnose or learn how to recognize disorders, but you also learn what the limitations of the DSM are and all about community mental health and how we provide services to folks who happen to have mental health and substance use disorders. And then you have a specialty class in substance use treatment, where we start from the beginning. You learn about specific assessments and individual treatment and group treatment and family treatment, all types of recovery models. As a matter of fact, you can walk out of this class with a training certificate that you can show someone when you're interviewing, that you have a little training certificate in motivational interviewing or some other kinds of training that really look good on your resume and are really tangible pieces that you can take with you when you graduate. And then social workers work in teams, as most of you probably know, and those kinds of teams include disaster relief programs. We work in hospitals, we work in schools, rehab programs, military services. As a matter of fact, military services go back to the 1900s when social workers first began working with folks in the military. And then the police crisis teams, which is an up-and-coming area that I think a lot of cities will be doing. So some of the locations, which this is a sort of a repeat of some of that, but one of the things that we really don't have as much knowledge about, I think, just in general, are the mental health courts. And that's the intersection of mental health, substance use disorders, and the criminal justice system, along with that right care, police model of care that I just mentioned. So, of course, we can also do private practice, and you're going to want to have this specialty if you want to do the private practice. I have a video here. Let me see if I can figure out how to get to it. That really, it's a great little video that actually shows you, here we go, this right care model where social workers are now embedded with the police, and we have much more funding being provided and studied for this particular right care program. Hopefully I'll be able to see it, hear it.
We can't hear it. The sound is the only issue.
Oh, that's too bad. Let's see.
Did you share computer sounds when you shared your screen?
It didn't give me the option, but let me see here. Let me come back to it. Usually it does, right?
Yeah, a little toggle in like the top.
It just, okay, here we go. Yep, there it is. Sorry. Thank you. You guys are so smart. Okay, we'll come back to it. Here we go. Can you see it now?
People out of hospitals and jails and addresses calls for police reform. And despite a very tight city budget this year, there are plans to triple the size of that initiative. Ken Kaltoff has more from one patient who endorses right care.
All right, cool.
Richard Keaton dealt with depression and anger problems through more than a dozen visits to hospitals in his life.
I have really bad anxiety problems with cops to begin with, because anytime I met a cop, I would either be handcuffed and go to the hospital.
He says a visit from the right care team was much different. Dallas police officer Aaron Rucker drives the unmarked SUV.
It's always going to be me, clinician, and paramedic.
Members of the right care team intervene on mental health calls.
We attempt to break the cycle, the revolving door, where individuals are constantly utilizing scarce resources, yet not getting exactly the help we need.
In the past, Dallas police response to mental health calls wound up with people in jail or at hospitals like Parkland. A 2014 response wound up with the fatal police shooting of Jason Harrison, a man who had a screwdriver. He was described as bipolar and schizophrenic. The officers were cleared of wrongdoing, but the incident helped support calls for reform.
Because sometimes it's a simple fix, no matter what it is. If it's transportation issue, if it's a housing issue, it gives them a new resource that they don't have to go to the hospital to get, or they don't go to jail.
Right Care works with Dallas County's mental health agency, Metro Care, at the Lancaster Clinic.
So we're able to provide these crisis intervention services same day, quickly to the individuals.
This program has really let the citizens know that we care.
I think it should go into different communities.
The past 3 years, Right Care operated only in the South Central Patrol District, but there were 1,500 mental health calls last year spread all over the city. The plan is to add 2 more Right Care teams next year for the rest of Dallas.
They helped improve my behavior to get a job.
Richard Keaton says Right Care has been the right care to help improve his life. In Dallas, Ken Kaltoff, NBC5.
So these are just some really cool models of care that are up and coming, and I think the field is always, working in new ways to provide services for people who have mental illness, people who have mental health issues, and people who have substance use disorders. So now I want to introduce our superstar student, Denise Draper, who is not only a graduate student leader, but she is our VP of MAVS for Mental Health Awareness Student Group. Take it away. Oh, let me pull up, I'll pull up the PowerPoint for you. Here we go.
We were over prepared.
Yes. We're overdressed. Hold on, let me pull that back up for you. Let's see. There we go.
Okay, perfect. Okay, so my previous background was as a school psychologist for about 15 years. And ultimately, I left that field for a variety of reasons. And I don't think I had any idea what a social worker actually did when I started this program last August. So I finished my foundation year over the summer, and this is my first year in the mental health substance misuse specialty area. I had a very narrow focus. I was coming in because I wanted to do direct practice. I wanted to be a licensed clinical social worker, and I had a very specific population working with mainly survivors of trauma, particularly like complex presentations of trauma. And then I got into my foundation year and I realized this is a whole other perspective in looking at mental health than the way I was previously trained through a clinical psychology type of model. So when I came into the program, I already knew that this was the track that I was going to take because it does prepare you the best for taking the licensing exam if you want to become a licensed clinical social worker and have your own private practice. And the coursework, like what I've started this semester, one of those classes is the 5352 that Dr. Roper was talking about, looking at the DSM. It prepares you for that licensing exam. Now, in my previous experience with understanding the DSM, it was completely through a different lens. So I really started to appreciate the difference in the holistic approach of social work as opposed to a purely medical model, which has been sort of the predominant way that mental health has been conceptualized up to this point. What I love about this specialty is, you know, I'm kind of having to retrain my brain in the way I think about assessment, but it is so much more comprehensive and holistic, using that person and environment lens and the strengths-based approach. It's unique to social work. It is not something I learned in psychology. That was a very, you're looking for deficits the way I was previously trained, where using a biopsychosocial model, you're looking for strengths. What can we build on? And not only that, you are considering the person in the context of not only their personal environment, all of the multiple systems that they interact with. So their community, their neighborhood, their, you know, even the government. So it is, I love being able, it's almost freeing in a way to be able to understand mental health as, you know, in the context of the entire person and environment, and not just, I'm doing a diagnosis, here's what's wrong with you. So that's what I love about this specialty. And, you know, the theme that I kind of was picking up on as everybody was talking is ultimately kind of all of these specialties do overlap, because you will see mental health and substance use across all of the other populations that we talked about. So there is a kind of overlap among all of them, but you know, right now, this is such a unique time to be training to be a social worker and focusing on mental health, because at some of the information that Dr. Roper was talking about, the suicide rates that we are post-physical part of the pandemic, that we're already in the mental health crisis part of it, but it's really going to become more and more of a an issue as we hopefully eventually come out of COVID. And also I'm very interested in crisis response. So I love that she talked about that. Also, shameless plug for our new student organization. We just started this, well, we started over the spring semester last year, putting it together. We are official now as of this semester, MAVs for Mental Health Awareness, MMHA. And this is open to faculty, anyone who's interested in raising awareness about mental health issues. The only caveat there is if you wanted to become an officer, you do have to be in this concentration. For membership, you can follow that link, and that probably is not clickable there. But if anybody wants more information on how to join, you can email me. If you can't see that on the PowerPoint, I'll drop it in there, or Tori Hopkins, who is our communications director, and get set up with becoming a member. We do have a small dues right now, and basically that's going towards like t-shirts and any events that we might have with special speakers and stuff like that. But that's MMHA, and we are really trying to promote ourselves right now because we just got started. So thanks.